There are many misconceptions first about migraines. A lot of people think migraine is just a regular headache. It's not a regular headache. But people need to understand that it may not be complete. It's not a curable condition. And you learn to live with it.
So we try to kind of
all these tests.
I retired, and obviously, but thankfully,
All right, welcome back. Welcome back to a brand new episode of Tell Me Why. Today we are podcasting from Abu Dhabi from a very special conference. And we're going to be talking about an issue that I face personally and that I know a lot of people face as well, which is the pain that we go through when we experience a migraine attack. With me is Dr. Ahmed Shatila, Neurology Consultant at Sheikh Shakhbout Medical City. How are you?
I'm excellent today. Thank you, Maria, for asking me. How are you?
Yeah, all good. It's lovely to have someone to ask me, how am I?
Right.
I mean, it's good.
Well,
good.
You're important too. So
Yeah.
Thank you for asking me, and thank you for having me today.
Thank you. It's part of being a doctor. You always ask how people are. So I feel like it's in your
Important,
nature.
right?
Yeah.
That's actually the first part of the interview, is to know how the person is, to get an understanding of the basic well-being of the person, because you don't want to just treat them. You want them to get back to the way they were.
Yeah.
And hopefully better.
Absolutely. I like that. Thank you for joining us today because as I mentioned in the intro, we're talking about a topic that, it resonates with me personally.
Okay.
I get a lot of these migraine attacks, and we're going to talk about migraines. We're going to talk about treatment.
Okay.
We're going to talk about lifestyle changes that can really help you get over certain attacks. So before we get started, we always hear about migraines. A lot of people might not have experienced migraines before. They've experienced your average headache. So we want to know, what's the difference between a migraine and a headache, and how do you treat both respectively?
That's an excellent question. So migraine actually is very common, actually.
Okay.
About 10 to 15% of the people suffer from migraines, which account for about 1 billion people worldwide.
Wow.
So it's very common. And what we need to know is migraine is not your regular type of headache. We all get headaches. It's common. People get headaches, and it's actually very uncommon not to get a headache at some point in your life.
Right.
But the migraine is different. It's actually a severe form of headache, and it has specific characteristics. Usually what we say is a migraine is a severe throbbing headache that tends to be pulsatile. People describe almost as if something is pounding on their head.
Right.
As if a hammer, like just hitting them on the head. They're sensitive to light, sensitive to sound. Mm-hmm. They may get nausea, vomiting. They like to go to a dark, quiet room, just tell everyone, don't talk to me, I'm tired, now's not a good time.
Right.
And it can last for about 3 hours to 3 days, severely impacting a person's quality of life.
Okay. And how is that different from a regular headache, let's say?
So, believe it or not, there are hundreds of types of headaches.
Hundreds?
Hundreds.
Okay.
There are books, volumes dedicated on how many types of headaches and the different types of headaches.
I didn't know that.
There are many types, actually. We're talking hundreds of types of headache. And migraine is only one type of headache.
Okay.
Out of the many hundreds that you may suffer from.
Okay.
But when we look at out of the hundreds, migraine is actually probably one of the most common type of headaches there is.
Are the triggers different?
Okay.
Is it stress-induced? Is it not? Like, what are the triggers, maybe?
So if we go back to what separates a migraine from the regular type of headache that we may experience, and it really comes down to the characteristics like the sensitivity to light, sensitivity to sound, the pulsatile headache, it's throbbing in nature.
Right.
It can start on one side, go to the other side, so it may start on the right, go to the left, and vice versa. And if you have these type of characteristics, that would really classify as a migraine. Now, other type of headaches you may have pain, but it may not have the sensitivity to light.
Right.
You may not be sensitive to sound. It may be pulsatile, but different characteristics. But when you put them all together, if you have what we say a unilateral headache that starts on one side and goes to the other, with photophobia, which is light sensitivity.
Right.
Phonophobia, sound sensitivity. Nausea and vomiting and throbbing in nature that lasts from 3 hours to 3 days, that's a migraine.
Right.
And if you have those, you have a migraine. If you don't meet those criteria, you have a headache, which could be one of the other hundreds of types that we discuss.
Right.
So that's really what it comes down to, is really, do you meet all the check boxes to what a migraine is? Because there is no test per se that, like, unlike blood pressure, if you have elevated blood pressure, you would say you have hypertension.
Right.
Or if your sugars are elevated, you would say you may have diabetes. Migraine, there is no test. It's really characteristics.
Okay.
You just really, if someone meets those characteristics or have a certain headache that with certain characteristics or qualities, that's the migraine. So it really comes down to the history.
Okay. And what causes it? I mean, I've been trying to figure this out ever since my late teens, because that's when I started getting migraines. What causes it? Is it stress-induced? Is it like our environment?
Many causes.
Okay.
And there are many causes of migraines, and everyone has a different, so your causes may not be the same as my cause.
Oh, okay.
Like I suffer from migraines, and for me, my migraines tend to be more triggered with caffeine.
Oh.
So if I drink a lot of coffee, I may get a migraine.
Okay.
Other people may be sensitive if they're exposed to bright lights. They may get a migraine. A lot of women, they will experience migraines at around the time of menses due to hormonal changes. So stress can cause migraines in certain people. Lack of food. We see it a lot during Ramadan when people are fasting.
Right.
They'll all describe, oh, my headaches are coming back. So really, different people have different triggers of what a migraine is. But what we know is, we do know that it's more common in women. And it's more common in young women,
Yes.
between 20 to 40s.
Yeah.
Now, does that mean younger people can get migraine? No, you can. And older people can get migraine older than 40. But predominantly, it's between 20s to 40s and mainly women. But men can get it, such as myself.
Right.
And children can get it. So there is really no, per se, one type of person who can get migraine. It affects all members of the community and really all ages.
All right. We're going to get to that women part.
Yes.
It's one of the questions I have in mind. But before we get into that, I just wanted to ask, what happens if you ignore a migraine or if you don't treat it? Could it lead to like other physical health ailments, or is there, like, could it trigger something else, or is it just the throbbing pain and that's it?
That's an excellent question. Migraine is not a fatal condition.
Right.
And it doesn't cause physical disability, but it can cause a lot of disability. So what are when I mean it's not physically disabling, meaning it doesn't cause paralysis. You won't end up in a wheelchair. You won't die if you get a migraine.
Right.
But it can still be extremely disabling. And it can affect someone's quality of life and emotional well-being. And, what do I mean by that? Like, if you're getting migraines a lot, you may want to withdraw from society. You don't go to work as much.
Right.
Or you may avoid going out with the children or with your family or even meeting other people because you're always worried, oh, I'm going to get a migraine, or I have a migraine and I don't want to go out. So it can cause people to be withdrawn from society, which is disabling in a different way. So in that sense, it is a disabling condition, but it's not a fatal condition. And if you don't treat it, it's not going to get worse, but it's still going to be disabling. You know what I mean?
Right.
Like, if you don't treat your migraines, there is no long-term sequelae about it, but it's still equally disabling, meaning that for the reasons I just mentioned.
Right. Yeah. I mean, we were always told that your physical and mental health are interconnected. I mean,
Exactly.
that's the new line that everyone is using. I mean, as you said, it sort of like halts you from moving on with your life, from enjoying certain things that you usually enjoy if you don't have the migraine, like spending time with children who can be loud,
Yes.
which is a sensitivity that you develop when you have a migraine. But that's essentially what happens when you leave it untreated.
Exactly, because if you're getting a migraine you want to go to a dark, quiet room and you want to tell the kids and the family, don't talk to me right now. Now's not a good time. And if that's happening, some people can get up to 15 headaches a month, if not more.
Oh, my goodness.
If you're getting that many headaches a month and you are withdrawing from your family that many days a month, that's disabling. That's time lost from your family. You know what I mean?
Yeah.
So it can cause a lot of anxiety. It may cause you to be depressed.
Yeah.
I want to spend time with my children or with my family, and I can't because I'm suffering from these severe headaches.
Right.
That makes me sensitive to light or, or sound. Or, you know what, I want to go work, but I can't work because I'm always taking sick days to go to work, and I can't function. I can't help pay the bills.
Right.
So there's a lot of anxiety, and it can cause depression. So it is one of those illnesses that carries a high burden, a high cost to society.
Yeah.
Even though, like I said, it's not a disabling condition in the sense physically.
Yeah.
It's still disabling, but in different ways, as I mentioned.
Right. And I feel like along with that is also lack of sleep. I mean, I can't even begin to mention how many times I've gotten these migraine attacks and I cannot even sleep. I can't even switch off or stop the pain or stop the, the pulsing, throbbing pain.
Yeah.
Just to sleep.
And that, because of the headaches, you can't sleep. And also the problem is the lack of sleep causes even more headaches.
Exactly.
So then you go into this vicious cycle of headaches beget headaches.
Yes.
And you kind of spiral downwards and you can't seem to fix yourself.
Right.
Or break that cycle.
Which leads to the lack of productivity and whatnot and everything you mentioned earlier. So you mentioned that it's more prevalent in certain segments of society and specifically women.
Yes.
Why is that the case?
Well, we think it's related. Well, we know at least for women, hormonal changes and hormones play a role in migraine.
Right.
So that's why during menses, the monthly cycle, a lot of women will experience a migraine or migraine-like symptoms. If you're taking any type of hormone, oral contraceptives, it may trigger migraines in women. But now that being said, that's only part of the picture. Because men, we don't have the same hormones as women, but men still suffer from migraines. So while hormones play a role, it's not the only reason why, or it's not the only explanation. It's just one piece to that puzzle.
Okay. Are there people that are more at risk of getting migraines, or is it just one of those things that you might be prone to it or not?
It affects all members of society, all races, all ages, all genders. So we do know that certain genders are more, like women are more likely to get migraine than men, but that doesn't mean it's not a female-only disease or a male-only disease, or it's not a disease of only young people. It's a disease of every age, every gender, every socioeconomic background. Rich people get migraine, poor people get migraine, young and old. So it affects everybody equally.
Right.
It's an equal opportunity offender, if you want to call it.
I like that. Okay, so the next question is everyone's question. What's the treatment? I mean, what can I do? Are there new treatments? Are there any advancements in the medical field that, are promising to people, suffering from migraines, giving them promising results or the results that they need?
First of all, I think when someone comes to see me in clinic, and they suffer from migraines or they have characteristic symptoms of migraine, it all starts with the history. And what do I mean by history? If you know your illness, if you know what causes your illness, you know how to avoid it. As we say in Arabic, الوقاية تنتهي العلاج, right? So if you know what causes your symptoms, I would tell you avoid it, right?
Right, exactly.
If you say, every time I drink coffee, I get migraines, well then, the obvious answer would be cut down on
coffee. Exactly.
If lack of sleep or certain foods cause migraines. So it's important to find what are the triggers.
Right.
And everyone has different triggers. Like I had just mentioned, I suffer from migraines. It's not very common, but still I get them, and I'm very caffeine sensitive. I still drink coffee, though, by the way.
Yeah, exactly.
But I know these are my headaches. Other people get migraines if they eat certain foods. like foods that contain nitrates or processed meats, they may trigger migraines in that group of people. So it's important to know what's your trigger. And a lot of times you may not know what your trigger is until you really sit down and think about, well, why am I getting these headaches?
Right.
What's causing it? So the first thing I tell someone is do a diary. Write a headache diary. First write down when you get a headache, what's happening, how long it lasts, what was happening around the time you had the headache. Did you do something differently? Did you eat something different? And see if you can start noticing a trend of, every time I get a headache, I do a specific thing. Then okay, you should avoid it.
Right.
And sometimes that works. And then that works a lot for a lot of people who have triggers. If that doesn't work, we have many medications for migraines. And I think we're lucky is that we can tailor medications to your specific needs. So we have oral medications, we have injectable medications, we have nasal medications that have been recently approved that work very well and very quickly. So what's the right medicine for you? Well, it depends. It's based on a lot of factors. And I think it's important to sit down with your physician and let them lay out the different options that are available, and you see what works best for you.
Right. I'm going to ask a really basic question, and it might be obvious, but I'm just going to ask it because I know a lot of people might have the same question. Are migraines curable, or are they just a chronic condition that you're going to have to live with and you need to manage one way or the other, either through treatment or prevention, as you mentioned?
Migraine is a chronic disease.
Okay.
So by hence being chronic, there is no cure.
Okay.
It's something that you learn to live with. It can be managed. So the goal of treatment, there is no thing that will say you take one medicine and you'll never have migraines for the rest of your life.
Right.
No, you'll need to take some medicine for a specific amount of time, whatever works for you. But it can be manageable. And the goal is to either decrease the frequency, so meaning if you get multiple headaches a month, let's say 15, we want to try to bring it down, let's say, to 5 or 10,
right,
or even 0, which sometimes happens. And sometimes if we can do that, that's great. But I'm also looking not only for frequency, I'm looking to decrease the severity. So sometimes people would say, oh, well, I still get 10 headaches a month, but they're not as bad. I can still function. So yes, you get 10 headaches a month. No, the frequency is the same, but they're not as disabling anymore. You can still function. You can go out. You got a mild headache, but you can still do the things that you want to do.
Okay.
And that is the goal of treatment. Ideally, I would like to get no headaches with no side effects, and you can live the way you want to do. But sometimes we're looking also to decrease just the frequency or the severity.
Okay.
As well.
I like that. So you get a lot of patients, I'm sure, and, a lot of people complaining of migraines. What are some of the misconceptions or the myths that people have told you from a patient suffering from migraines?
There are many misconceptions, first, about migraines. A lot of people think migraine is just a regular headache. It's not a regular headache. So a lot of people sometimes say, oh, it's a sinus headache. I have sinus headaches. And no, you don't have sinus headache. Sinus headaches are very particular. They have a certain type of symptom. They present differently. Their presentation is differently. But a lot of times people say, oh, I have sinus headaches. You're like, no, you probably have migraines. A lot of people think that, oh, maybe this is one of those things, one of those illnesses. Oh, I take one medicine for a short period of time and I'll be cured. It's a chronic illness. It can be managed. We can probably try to achieve a goal of no headaches, or at least a better quality of life with decreased headaches. But people need to understand that it may not be complete. It's not a curable condition. And you learn to live with it, and you learn to manage it. If you know what your headaches are, you are empowered. If you know what causes your headache, if you know your own illness, then you're able to manage your illness and empower yourself to live a life as active as possible, I think.
Right. Okay. So I'm going to take it a step further.
Sure.
So further from the migraine attacks, but when do you know that it's not a migraine attack? Maybe it's something worse. Like, what do you look out for? What are the investigative procedures you would say are necessary at that point?
You know, that's a great question. And what are the red flags?
Right.
So first of all, like I said, there is no test. There is no migraine test. And because there's no test, the diagnosis can be done based on symptoms. I don't need to do imaging for someone with migraine.
Right.
You don't need an MRI. You don't need a CAT scan. Actually, guidelines recommend give me a history that sounds like migraines, and you meet all the check boxes for a migraine, and you have a normal exam, we don't need to even do imaging on you because it's probably migraines.
Right.
Common things being common, you have migraines. Now, what are the red flags, or what are the times when we think it's not a migraine? When the headache quality changes. So let's say someone comes into my clinic and they say, I've been suffering from a specific type of headache my whole life. It's always like this, and it's caused with certain symptoms, and it presents a certain way.
Okay.
But now it's different. My headache changed. It's no longer the same type of headache that I used to experience.
Okay.
Something's different about it. That's a red flag.
Okay.
If you have any type of neurologic symptoms, what does that mean? New onset weakness, numbness, unsteadiness, without a headache, another big red flag. That would need further workup.
Okay.
If you present, like I told you, migraines are most commonly present in 20s to 40s, as I mentioned.
Mm-hmm.
But if someone comes to my clinic for the first time, older than 55, that would be another red flag. New onset headache for someone who's never experienced a migraine in their whole life. And now they're saying, oh, I think I have migraine. That's a red flag. It may be, but it warrants further workup and further investigation.
Right. Okay. And is there anything specific to the UAE when it comes to migraines that you can share?
Well, the UAE, just like everywhere else in the world, migraines are common here.
Okay.
But we also know that migraine, because of heat, we do know that certain people, and a lot of time we know that dehydration can be a trigger for migraine.
Right.
And, in the summertime, it can get very hot, and people can get dehydrated, and that can trigger migraines. Bright lights, sunlight. Sometimes people say, when I'm driving, just the bright sunlight can trigger a migraine in me.
Mm-hmm. Moving on to you a bit more and how you feel when you treat these patients with migraines. Like, how rewarding is it? Like, how do you feel that you're actually helping people relieve that pain?
It's extremely rewarding because if done correctly, you can significantly change someone's quality of life.
Okay.
I mean, and by what do I mean by change? Sometimes by just knowing that you have a migraine and knowing what causes your migraine and what triggers your migraine, you may actually be able to reduce the quality and severity of migraine. Hence, that person can go back and be a father, a mother, a brother, sister, or a functioning member of society and go back to work. That's extremely rewarding to see someone who is debilitated from their disease, I'll call it. And now do you notice, you're able to bring them back to what they want or what they would like to do. So and it is an extreme, and migraines is a very treatable condition, meaning that you can get very good response. You can live an excellent quality of life because we have many treatments for it. And then because of that, I think that's extremely rewarding to see people just live a life free of headaches.
Right.
Or where the headache is not disabling them like before.
Absolutely. I know you had a very long day, and you were just telling me before the show that you spent your whole day in the clinic, and now you're here with us, and we're very grateful. But before we let you go, your last piece of advice for anyone that might be experiencing these symptoms, but they just don't know where the solution lies, and they don't know what to resort to at this point, what's your advice?
My advice is, if you suffer from a headache, and it's not just the headache I get every now and then. Mm-hmm. If you're suffering from a headache that's disabling and the headache has a certain characteristic, what I just described. Don't self-medicate. Don't go to the pharmacy and take a bunch of over-the-counter pain meds, because you actually may only make your headaches worse, and you may not actually solve the problem. Go see a physician, preferably see a neurologist. That's what we specialize in. We take care of headaches. That is what we do. So see an expert. See someone who knows how to diagnose this condition and then properly manage it. But also, don't self-medicate yourself. I think that's the most important thing.
I love that. That will be my takeaway. Don't self-medicate. Don't self-diagnose.
No.
You know, the likes of WebMD or TikTok now, obviously,
Yes.
like all these, self-diagnoses. I mean, it's not accurate.
Exactly. And I would say, definitely don't ask Dr. Google. Because if you ask Dr. Google, if you put all the symptoms, you probably are going to say you're dying of a brain tumor.
Exactly.
And in fact, you probably have a migraine.
Exactly.
So don't go to the internet, try to look for answers of what you have and how to treat what you don't know.
Exactly.
Leave it to the people who actually studied this and spent their lives treating this condition.
Absolutely.
That's what I would say.
Absolutely. Dr. Ahmed, thank you so much for joining us today.
Thank you so much for having me. Thank you, Gulf News. This was excellent. I had so much fun today. And thank you, Pfizer, today for allowing me to speak. So it's been so much fun. And I hope if only one person knows or learns something today, that is a success for me.